In today's Health Alert, a new report showing Detroit is now the worst city in the country for people with asthma.
The Asthma and Allergy Foundation released its annual report yesterday, ranking the top 100 most challenging places to live with the condition, and Detroit topped the list. Our Dr. Nandi joins us live. And Dr. Nandi, why is the D at the top of the list, and why is September such a tough month for asthma?
It is something you don't want to be number one at, right? So listen, lots of people don't know that where you live can affect how well you can control and manage asthma. Now, the Asthma and Allergy Foundation of America actually looked at asthma rates, ER visits, and deaths across the country. And here's what they did. They ranked the top 100, Glenda, and Detroit came in at number one. Why? Because we have higher than average asthma cases and higher than average deaths from asthma. That's right, deaths from asthma. So why might this be happening in the Motor City? Well, poor air quality and limited access are two major factors, according to this report. Other things like high pollen, more infections, poverty, poor housing and schools can all make asthma worse. As for why September is Asthma Peak month, that's because several triggers come together. Kids are back in school, respiratory infections spread, and weed pollen peaks. And all of this leads to a spike in asthma emergencies and hospitalizations, first in children and then in adults.
Andy, next week is the third week of September, which is called Asthma Peak Week. So what steps can people take if they're living with asthma?
Asthma itself, Linda, is a chronic condition where airways swell, narrow, and fill with mucus, and that makes it harder to breathe and can trigger coughing, wheezing, or even chest tightness. And attacks can be life-threatening, and that's what's important if it's not managed. Sadly, every day in the U.S., get this, 9 to 11 people die from asthma. And the good news is this: there are steps you can take to protect yourself. First, see your doctor or specialist to look over your symptoms, triggers, and medications. Make sure your asthma action plan is up to date so you know what to do if symptoms worsen. Next, keep up to date with vaccines. Important. Like the vaccines for the flu, COVID-19, RSV, and pneumonia. These infections can really flare up asthma. And also really pay attention to your environment. Improve air quality indoors by changing filters regularly and keep air moving with good ventilation. Also, before heading outside, remember to check pollen and air quality reports. Be sure to limit time outside on high-risk days. Unfortunately, asthma, Glenda and Simon, cannot be cured, but it can be controlled. And with the right care and awareness, folks that are living with asthma can stay healthier, avoid unnecessary trips to ER, and also prevent some of these deaths. And that's the key here.
That is the key. Thank you, Doc, for joining us today.
Oh, my pleasure.
If you have a question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook. We'll get it right to him.